Hi, my name is Dr. Jane Thornton. I'm a sport and exercise medicine clinician, as well as a researcher in injury prevention and physical activity for health, particular interest in the female athlete. And I'm also an Olympic rower who's competed for Canada for about 10 years. And I wanted to talk to you today about relative energy deficiency in sport, give you an introduction of what it is, some of the aspects that we think about as clinicians and doctors, healthcare providers, as well as give some tips and strategies for athletes and coaches. So I'm going to share my screen and give you some of this information that we've learned about for the past several years that's been recently updated through the IOC consensus statements. So the first thing people often ask about is what is relative energy deficiency in sport, or either REDS or RED-S. Normally, the experts call it RED, sorry, so that's what I'm going to continue with. And it's a syndrome, and we specifically look at REDS as this impairment in physiological or psychological functioning. And it's experienced by both female and male athletes, and it's because of exposure to either prolonged or severe low energy availability. And that's what LEA stands for here. So these outcomes include, but aren't limited to, decreases in energy metabolism, reproductive function, musculoskeletal health, immunity, glycogen synthesis, and cardiovascular and hematological health. All of these can be individually and synergistically lead to impaired well-being. So thinking about increasing injury risk and decreased sports performance. I'm going to break all of those down. But if we look at some of the infographics that have come out about REDS, you can see here that there's two circles. The one on your left is looking at relative energy deficiency in sport as it relates to overall health. And then on the right side, how we look at REDS in terms of our impact on performance. So as an athlete, sometimes we tend to forget about our health, especially in the short term if we have an important competition or selection or something like that coming up. So it's often useful to think about both of them, that it's not just a health perspective. That's obviously the top of my list as a doctor, but certainly also the performance aspects as well. So we'll go through some of these one by one. So from the health perspective, when we have low energy availability, meaning there's that imbalance between the amount of energy or calories that we take in versus the amount that we expend through training or some other reason, then if we have this continuous low energy availability, then you can imagine that our body thinks it's in starvation mode and starts to shut down these potentially non-essential or not as essential systems. So if we think about reproductive function, and this is where periods come in, or even low testosterone in male athletes. So we lose our reproductive function when we have too low energy availability. As a result, those hormones also have an impact on both bone health. So we can have an impairment in bone health, meaning that the bone isn't growing, it's constantly building and breaking down. But if we don't have those hormones that are essential for bone health, as a result of this impairment in reproductive function, then we don't have that good bone remodeling happening, that it's breaking down more often than it's building up. And then, of course, that's going to be a big problem if you're still in those bone building years. So critical during teenage years, but even up to the age of 30 and beyond. 30 is when we start kind of reaching our peak bone mass, and then we start losing it bit by bit. So it's crucial always, but potentially even more so when we're thinking about the times that we should be building bone if we're not just getting up to those levels that we want to be. Low energy availability can also impair your gastrointestinal function, so meaning how food is transiting through your GI system. It's affecting motility and digestion, as well as energy metabolism and regulation. So we start going into a lower metabolism, basically, again, because of that adaptive ability of our bodies to say that we need to kind of store up, and our bodies sense that we are not taking in the same amount of calories, so we metabolize at a lower rate. Hematologic function can be impaired as well. So those are blood markers, things like iron availability, things like hemoglobin, and these blood markers that are imperative for both our health and performance. It seems that people with low energy availability also have higher rates of urinary incontinence, impaired glucose and lipid metabolism. We can also think about mental health as being a very big issue, of course, but more so with low energy availability, mental health can be compromised. Also, things like neurocognitive function or concentration, and it can also impair sleep, cardiovascular function, and even how our muscles are working. And of course, if you're thinking about your bone health and you're in that stage where you're still growing, it can also impact growth and development. So this is why we've moved beyond a term that we used to use many years ago. It's still in circulation in some places, but this concept of what was known as the female athlete triad. And those were three things involving low energy availability, and then impairment in menstrual function, and then impairment in bone health. But we're starting to see now that a lot of systems, as you can see here, are affected. So really critical to keep that energy availability high. And then we can look at performance outcomes. And again, this is something that as athletes, it may be top of mind, especially in the short term, that we might not be as concerned as from the long-term health perspective, but certainly something to think about as you're performing and training for performance. So athlete availability can be decreased, meaning that people are probably because being either sick or injured more often, so they're not available for games or practices or competitions. There could be a decreased training response and decreased ability to recover. And thinking about cognitive performance and skill is compromised, as well as motivation, and that it also relates to mental health. Decreased muscle strength, endurance, and power. So all of these systems can be compromised as a result of not having enough energy availability. So when we think about all of these things, certainly at the top of our mind is how do we actually prevent this and screen this? And as a treating physician of many athletes that have come at various stages of relative energy deficiency of sport or different presentations, so different reasons. Some people have lost their periods, some people have had a stress fracture, some people have low libido, some people have decreased sleep or poor mental health. Starting to understand all the nuances and parts of relative energy deficiency in sport is important. We also really want to emphasize that adequate energy availability can really help in these areas, and to really think about adequate fueling strategies. So when are you fueling? How much are you refueling? What is it looking like for you? Are you getting enough fuel? So athletes and supporters, I would just say ask for help early. It is harder and harder as it goes on and becomes more prolonged to potentially reverse. And so sometimes when we get into more difficult presentations, like a full-blown eating disorder, for example, or someone who's had multiple stress fractures that have maybe become a completed fracture, those kinds of things are more difficult to treat and often take a lot longer. So if you're concerned about energy availability at all, or even just want to check in, it's great to be able to look into that early. I've also seen athletes who have just not even known that not having a period was abnormal. So they thought maybe it was a sign of training hard enough, for example. And so even just that education early on to say, hey, you know what, you've missed a couple of periods, let's start to get them back because we want to help your health and performance. And sometimes that's very easy to reverse. It's just a matter for them to refuel more and a matter of education. So sometimes this is unintentional and people just need a little bit more education as to absolutely having a period is a normal part, and something that if you're starting to lose periods as a result of training too much or not taking in enough calories, then we do want to help reverse that and restore normal function. And coaches can help in this area as well. And it's really about thinking about a culture of openness, really understanding athlete autonomy, understanding a supportive environment. I think it's starting to happen a little bit more than it used to, in terms of understanding that your athletes may have symptoms related to their menstrual cycle, that they may lose their menstrual cycle or have difficulties with it, or maybe they're coming to you as with one of the other things that we talked about in terms of systems, lack of sleep, mental health aspects. So starting to understand that as a coach, you want to optimize player availability as well as their health and performance. So really starting to understand what you may want to do in terms of identifying REDs, and also thinking about making some training modifications in those specific instances. And we all play a role in terms of prevention, identification, and support. So whether or not you're someone with REDs or you have a teammate that you suspect might need some encouragement and support, or you're part of the athlete entourage in another way and support staff or a coach, or if you're someone on the healthcare team, really it's a great way to understand more about this condition, to be able to intervene early so that it doesn't become a problem later on. And ways that we look at screening, there's good tools available for us. And this one came out just recently. And it's the REDS CAT2, so the clinical assessment, and it's a second version, which is why it's called the CAT2. And when I counsel athletes on REDS, I show these kinds of scales right away so that we're all on the same page as to why we might make a clinical decision one way or the other if someone has one of these markers. So if you're in the green on this arrow, you're essentially in the clear that if you're not having any issues, for example, with menstrual cycles or libido or sleep or fatigue or mental health and so on, you're probably at very low risk of having relative energy deficiency in sport. And so we don't have to treat that, obviously. So we do ask questions and history, ask through screening questionnaires. But if you don't really have any indicators of having REDS, then of course we wouldn't manage that or treat that any differently. We start to think you're in this yellow zone, that you might have one or two primary indicators of REDS, or you might have some of these signs. We just want to potentially monitor at this point, make sure we have regular follow-up, but you still can compete, get into full training, and so on. As we start to move down into orange and red, that's when we want to keep a closer eye to make sure that things aren't getting worse and compromising your safety and that of your team. So those are when we might have more indicators of or more severe or prolonged low energy availability affecting multiple systems, or potentially if you have you've had as a female athlete, a long time of amenorrhea or lack of menstrual cycles, or if there's other things that might be a male or female having disordered eating patterns or eating disorders, they're just not getting better. We need more support. This is really when we want to have a team approach to not just identification, but also management and aspects of return to sport. So this is when a doctor might be more involved and also include other people, and that could be a sports psychologist or sports psychiatrist, and it could be a registered dietitian, it could be a physiotherapist. There are other people that could be involved depending on the nature, severity, or the presentation. So it could be an obstetrician or gynecologist, it could be an endocrinologist, and so on. So it really does depend on where that athlete falls along the continuum, and if they're progressing in a good way or in a more severe way that we want to be watching more carefully. So treatment from that perspective as well, as mentioned, we really want to intervene early, and this is where a multidisciplinary approach really comes in well. And sometimes that involves coaches, sometimes it doesn't. It really depends on confidentiality, who's in the circle of care, how athletes want to proceed with who they want to involve. And so sometimes it really can just be an anonymous or, a confidential kind of visit with a sports medicine physician or otherwise to just get a sense of what's going on. And sometimes it can just be managed in that sense. Sometimes if it's prolonged and it affects other people on the team, it may be beneficial to have coaches' input as well as other people on the team that form part of your support staff and your support or your entourage. So those are the kinds of decisions that are made likely on an individual basis. But this treatment primarily focuses on increasing energy availability and restoring hormonal balance, improving bone health, and then addressing any psychological risk factors. And again, it's not to point the finger at an athlete or anyone in terms of, you're here, what do we do now? It's often about education, just really trying to optimize health and performance. And even if it's just from that angle of improving performance, it's well worth that visit to someone to ensure that everything is good. And so you can scan this QR code as well if you want more information on REDS and the clinical assessment tool and how we approach relative energy deficiency in sport, as well as any information about the lab that you might want to hear about as well, as we do a lot of female athlete research. I want to particularly thank the people that have sponsored and the programs that have sponsored this presentation, and that the one that we have given to U Sports at the Cross Country National Championships. And thank you for your attention. If you would like more information, feel free to reach out at our website below, and someone will get back to you. But I wish you optimal health and performance along your athletic journey. Thanks.